Do you feel in this respect that there isn't enough awareness that, before one goes to a counselor or a therapist or anybody, whoever is your support structure, जिसके पास भी आप जाएंगे, पहले you, as you said, acknowledge and accept. Is there lack of awareness? इसीलिए डॉक्टर के पास नहीं जाते?
और स्टिग्मा है और लैक ऑफ रिसोर्सेज है. मेंटल हेल्थ रिसोर्सेज कहाँ है? सी our own surveys, there's a national mental health survey in 2015-16 done by in 6-7 states, jahan pe we are saying 75% people do not have access to mental health services.
True.
Right? The human resource shortages are there. Who provides the mental health service? And then most of the mental health professionals are trained in a medical model of the illness as opposed to a biopsychosocial model of the illness. That there's a matrix of causes, right? Causes a mental health problem, right? And ultimately, as a doctor, you with 40 people sitting outside your OPD, or 100 people if you're in the government sector.
You have 15 minutes or 20 minutes a
you
patient.
Have 3 to
Max.
10 minutes with the patient, and then you're trying to say, okay, I have to address this, I have to address this. So you do the easiest job, come to a diagnosis, prescribe a medicine and move on. Because at least kuch to farak padega. It's well-meaning, but it also, somebody has worked very hard to get to your door. Right? For them, it does not matter that you're a psychiatrist, psychologist, counselor, therapist, whatever name you might give.
Dr. Babu.
You are the solution provider. And you are their only hope, who they feel would understand what is the impact of what is happening in their life. It might be because of neurochemical changes in their brain. It might be because of stress due to a narrowly defined success by their parents. It might be because of an examination system that has paper leaks or is rigid. It might be because of discrimination faced on the basis of culture or caste or zillion. It might be because of your experiences that you've had, because of 100 things, but it's affecting your thoughts and feelings and the way you are interacting.
But they've been brave enough to come to the doctor,
right?
But the doctor probably goes through the medication route because he has only 10 or 15 minutes, or maybe less than 10 minutes.
So in that tone, we end up blaming the service provider.
We don't actually.
Because
that's just it.
As a service provider, I can tell you, I'm an informed service provider, right? I know the issues of violence. I know the issues of the context. But the reality is that in all the time that I have to educate the patient about the nature of their problem, about where it originates from, how I have to offer hope. I have to make sure that they are compliant with the treatment. In all that, I have to do that. And in Delhi, there are not more than 300 psychiatrists for the whole of Delhi.
The population.
This is the major issue.
Click here to watch the full episode.